just thinking that for so many years I would tell Dr. Parr, if you died, I don't know what would happen to me. Or I'd sort of like mentally prepare myself. What if he's not here one day? Because that's how transformational he's been in my life. So my name is Tamara Astafan, and I'm a psychologist. I met Dr. Parr about 10 years ago. So I was early career professional, probably 2 years post-graduation. And I was going through a rough transition. Newly married, just had a baby. And there were some difficulties there, and I knew what I needed to help me. And I knew the type of therapy that I thought would be helpful to me based on my own patterns of thinking. And so I looked up a therapist in rational emotive behavior therapy in Tampa. And I don't remember how many people showed up, but he was the one. And I called him up. And that was the start of a journey, because I started off as a client, and our relationship kind of progressed to him being more like a mentor to me. So I've learned so much from him, and he's influenced the type of therapist I am. A lot. He's really influenced the way that I do therapy. It comes in so many forms because he incorporates Eastern principles, Western psychology, but then we talk about things like philosophy and how it relates to life. And so it just sort of naturally infiltrates the way that I do psychotherapy. I know what it has done for my life and my clients. And so if one cannot afford therapy, then you want to get sort of like the next best thing. And we have so many resources. So if that's a start to give you some guidance, but also introduce you maybe down the line, then sure, of course. I would say that never give up. I think a lot of times when people are in despair, part of the despair is thinking that things will never change, or that they can't stand it. And those are two big things that can keep someone in a great deal of distress. And so having the hope that things can change, things naturally change, life is constant change is one, right? But that if you can get to a place of acceptance of things that you don't have control over, and then learn strategies to watch your thoughts, and understanding that the thoughts are not facts, and that if you can watch your thoughts non-judgmentally, but in some situations that helps, which is what the mindfulness part of it. But the other part is when you are latching onto a thought, taking the time to take it apart from the rational emotive behavior perspective, and knowing what are rational ways of thinking and irrational ways, and learning to dispute those, then you can allow yourself to have thoughts that may be distressing if you latched onto them, but you don't sort of become one with them. So.